Have you ever found yourself thinking about a public health rule, one that seems to help a lot of people but still feels like it's stepping on your personal freedom? Well, that tension, that constant balancing act between me and we, is exactly what public health ethics is all about. It's a really fascinating world where our individual rights bump up against the collective good. So let's dive in.
To really wrap our heads around this, we first have to understand a fundamental split in how medicine even thinks about health. It's not all the same. And this difference, well, it's the whole ballgame.
Okay, so what we're looking at here are two completely different worlds. On one side, you've got clinical ethics. This is your doctor's office. Their entire universe is you, the individual patient. The goal is simple: care for one person. But then, on the other side, you have public health ethics, and the focus just explodes outward to cover the entire population. The goal here isn't just to treat someone who's already sick, it's to create the conditions where everyone has a shot at being healthy. It's a massive shift in perspective.
So that leads to a pretty obvious problem, right? If your main focus is the whole population, what happens when what's best for the many clashes with the rights of an individual? This question takes us right to the heart of the matter.
And this is it. This is the question that sits at the very center of pretty much every big public health debate you can think of. Whether we're talking about mandatory vaccinations or smoking bans or quarantine rules, it almost always boils down to this fundamental tension: individual liberty versus our collective well-being.
You know, there's this famous definition from the Institute of Medicine that just nails it, and the key word in there is collectively. Public health isn't something one person can do on their own. It's something that requires all of us to act together as a society.
So if you're going to remember one thing, it's this. The entire field of public health ethics is basically built around trying to solve this one puzzle. How do you find a fair, just way to balance what's good for one person with what's good for the entire community? And let me tell you, there are no easy answers here.
So, if it's so tricky, how do people even begin to make these decisions? Well, over the years, thinkers have developed different philosophical models. Think of them as different lenses you can look through. And each one gives you a slightly different angle on the problem.
First up, we have utilitarianism. You've probably heard of this one, right? It's the classic greatest good for the greatest number approach. From a public health standpoint, this means you choose the action that's going to produce the best health outcomes for the most people. You know, a policy might inconvenience a few people, but if it saves thousands of lives, a utilitarian would say it's the right call. It's all about the results.
But then you have a totally different way of thinking called deontology. This lens doesn't care about the outcome. It focuses on the action itself. It says there are certain universal moral rules we just have to follow, things like respecting individual rights or always telling the truth. From this point of view, an action that violates someone's basic rights could be considered wrong, even if it leads to a really good outcome for a lot of other people.
And our third lens is communitarianism. This approach kind of shifts the focus again. It argues that what's right and wrong really comes from the shared values of a specific community. It puts a lot of emphasis on our responsibilities to each other and really pushes the idea that public health is a common good that we all have a duty to protect together.
So as you can see, each of these theories has its strengths and its weaknesses. Utilitarianism is super practical, but the big criticism is that it can be unjust. It cares about the total amount of good, but not always about how that good is distributed fairly. Deontology is great for upholding principles, but it can be rigid and sometimes ignores really terrible consequences. And communitarianism is fantastic for building community, but it runs the risk of what's called a tyranny of the majority, where minority groups get left behind.
Okay, so these theories are really interesting to think about, but let's get real. How does a public health official on a Tuesday morning actually decide what to do? They don't just sit around debating philosophy all day. They use practical tools to get the job done.
And that's where frameworks come in. Think of them as structured guides that translate these big, abstract, ethical ideas into a set of practical, answerable questions. They help make sure decisions are made thoughtfully and, really importantly, transparently.
So for example, take this fantastic framework from an ethicist named Nancy Cass. It forces you to get really specific. First, what are we even trying to do here? Second, is this plan actually going to work? Third, who might be harmed or burdened by this, and how can we reduce that harm? And finally, the big ones. Is it fair? And how do we balance everything out? It's a step-by-step process for thinking through the real-world impact of a choice.
But it's not just about frameworks and checklists. The field also has a formal code of ethics that lays out the core values and commitments that public health professionals are expected to uphold.
And what's really cool is that when you look inside this code, you can see all those theories we just talked about coming to life. It calls for respecting individual rights. That's a very deontological idea. It demands that community members get involved. That's classic communitarianism. And it insists on fairness and justice in how everything is distributed, which is a direct answer to that big criticism of pure utilitarianism.
All right, so after all of that, what's the big takeaway here? Why does understanding all this stuff about ethical debates and frameworks, why does that matter to us in our daily lives?
Well, I think the most important point is that there's no magic formula here. There's no single right answer that works every time. The goal isn't to pick one theory and stick with it no matter what. Instead, the real goal is to have a fair, open, and transparent process for making these tough calls, a process where all these different values are actually heard and considered. You know, one thinker, Raymond Massey, had a great way of putting it. He suggested we think of these as lighthouse values. These are the core principles that can guide us through the fog of a tough decision. Even when the theories seem to conflict, we can look to these shared values like justice, solidarity, individual autonomy, and responsibility to help us find our way forward.
So, I'll leave you with this thought. The next time you see a debate about some new health policy or rule, try to step back from just asking if you agree or disagree. Ask a better question. How are they trying to balance all of our shared values here? Because finding that balance, that's what public health ethics is all about.